Welcome to this screencast where I'll be discussing the spinal nerves. And if you are interested in the cranial nerves, that is another screencast. So, identify, we should be, by the end of this, you should be able to identify and describe here what we mean by a nerve plexus and spinal nerves, as well as a ganglion or ganglia, plural, and then a peripheral nerve. So there's all these terms here like nerve, but then where they are is sort of important anatomically. So there's peripheral ones, there's spinal ones, and then there's this nerve plexus. So ultimately, you should be able to describe the relationship between all of these, like the nerve root, the ganglia, the nerve, and then the spinal cord. We'll look at what a dermatome is and how it might be used and why it might be important. And then several spinal and peripheral nerves and the regions of the body that they innervate. Okay, so here is a diagram of the central nervous system. Here's the brain, and then the spinal cord is running down here. But then the peripheral nervous system is what we're interested in. Involves any of the nervous tissue that is branching off of that central nervous system. Commonly referred to it as branching off, which would imply that information is sort of going this way. But keep in mind, of course, that information is also flowing in these nerves toward the central nervous system from the periphery. Right? So in that case, or because of that, because there's information going toward and information going away, these nerves are referred to as mixed nerves, typically. So these nerves are associated and named and numbered based on which part of the spinal column they are associated with. So you see that there's a break right here, and all of these are the C's, right? And so the C's are for cervical in the neck region, and then these next 12 are thoracic, associated with the rib cage and the abdomen, and then down here, these L ones are lumbar, and then you have finally a sacral spinal nerves, and then one coccygeal nerve. Now, the nerves themselves are separate individual sort of strings, if you will, and you can kind of see that here. But then you also have these groupings of nerves that are all sort of forming this web or this network, and these are the plexuses. So there's a cervical plexus, which is C1 through C5, and then you have this brachial plexus. The cervical and brachial plexus are sort of like seen better in this area over here, right, where they are forming this network, but then out of that network are going to come the nerves that are innervating the shoulder and the arm out of the brachial plexus, and those that are innervating some of the muscles of the head and neck, or sorry, not really of the head region, but of the neck and upper shoulder region. One of those important nerves in the brachial plexus is the phrenic nerve, and this extends it down to the diaphragm, and of course this is important for regulating and controlling breathing. So if there's damage to that phrenic nerve, then breathing is affected. The other nerves in these areas, say of the shoulder and the arm, are named for that region, as in the axillary nerve. So this would be going sort of near the armpit, innervating the muscles near the armpit. This musculocutaneous, innervating the muscles, and then the cutaneous, referring to the skin in that region. And then you have the radial nerve, the ulnar nerve, and the median nerve. The radial and the ulnar nerve, of course, are referring to the radius and the ulna of the forearm, and then the median one is in the middle of those two. Okay, so these are some nerves that you should be able to identify on a diagram or on a model. Moving down to the lumbar plexus here, again, we see the same sort of grouping or collection of nerves here that are going to be branching, and then finally forming nerves, individual single nerves, for example, the femoral, right, the gluteal, and then the largest nerve here in the body is the sciatic nerve, and that sciatic nerve is here, and it moves all the way down that posterior side of the leg, and that sciatic nerve is branching off of that sacral plexus. Right? So this would be the sacral plexus in here, and then of course you see this sciatic nerve. Okay, so these are just some other ones. These nerves, this axillary, this phrenic, this radial, ulnar, all these guys over here are sometimes also referred to as peripheral nerves. Peripheral nerves. Depending on the text, they wouldn't necessarily be called spinal nerves. So let me talk about that difference between a peripheral nerve and a spinal nerve here. Now, so we've seen this diagram before of a cross-section through the cord, and we see that there are efferent fibers coming into the cord, fibers meaning axons. So this is an axon or fiber. So the afferent fibers bringing information into the dorsal side here. This would be the root, and then this would be the ventral root. They're going to fuse or join here, and this part would be then the spinal nerve. And you see that this one again is a mixed nerve. We have afferent here as well as efferent. So afferent as well as efferent fibers in that spinal nerve. So this little spinal nerve here is going to be a short little nerve. And if we take a look at this section through the cord, this extends it out into this peripheral area again. So we can identify, again, the cross-section through the cord. Here is our dorsal root and our dorsal root ganglion. Here's our ventral root here. This would be our short little spinal nerve, right? So there's the spinal nerve. And then it's going to branch, right, and become either a ramus, right, a horn, a branch of that, right? So some of them move dorsally into like the back of the body, and some of those horns will move anteriorly, right, or ventrally toward the belly, and innervate innervate the muscles. In this case, of the thoracic area. So we're seeing here in the thoracic area. So this would kind of be following where the rib goes, and again, you're going to have efferent as well as afferent information there. On this other side of the diagram, what I want to point out is sometimes the nerves, these spinal nerves here, will branch and then get eventually hooked up to these swellings right here, which are the ganglia, the sympathetic chain ganglia. So in here we are seeing mostly motor axons, motor fibers here in these ganglia. So as ganglia implies, there will be what you should be seeing there, if you look at diagrams closely, is an axon synapsing with at least one other cell body right there. So this ganglion is going to be a collection of nerve cell bodies in the peripheral nervous system. And so we'll see those when we look at the parasympathetic and sympathetic nervous systems. So again, here are some peripheral nerves and spinal nerves that you should be aware of and be able to identify. So we're going to go with this axillary nerve. We're going to go with radial nerve, musculocutaneous nerve, the median nerve, and the ulnar nerve. And so being able to know where the radius and the ulna are important. So you may want to practice that in class. Diagrams, models, etc. So in the leg, we will of course be worried here about the sciatic nerve, right? But we can also identify the femoral nerve. Is a rather large one. And again, this is on the anterior side, and then the anterior femoral cutaneous. On the posterior side, we will be able to identify this tibial, common fibular, posterior femoral cutaneous, and then the deep fibular, superficial fibular, and the sural. And then finally on the bottom of the foot here, these plantar branches. And again, these are named for the general anatomical regions that they are innervating, right, or going to. Okay? So that brings us to here, this dermatome. So these dermatomes are maps of innervation by the spinal nerves. And these diagrams always creep me out a little bit, but what they're showing you here is that these are the areas where C4, right, so cervical nerve C4 would be innervating the shoulder area. Right? Cervical nerve L2 would be innervating this area here. And so these maps provide clinicians a way to help diagnose if there's any sort of nervous damage, right? So you could be asking a patient to wiggle the big toe. If they can wiggle the big toe, then you know that the motor tracks are intact. What about can you move any of your toes at all? So you know that S1 and L5 then are intact. You might also then apply pressure to them here, so you can test motor output by asking them to move any sort of structure. You then test sensory input by asking them, do you feel this? So can you feel me touching your big toe? Answer is yes. Okay, those nerves, those tracks are intact there, most likely. Can you feel me touching this little pinky toe here? No, I cannot. All right, well then perhaps the damage then is a little bit lower, right? And your damage wouldn't be, the damage to the tissues would be somewhere down here in the sacral region, right? And not up here in the lumbar region. So you can rule out or rule in any sort of damage area by knowing these rough maps of the dermatome and where those nerves are innervating. So this table here summarizes a lot of information that might be helpful. I'm not sure that you need to copy down every last little thing, but it's showing you the name of the plexus, right? And then which major nerve are associated with that plexus, right? And then the distribution or the innervation that those nerves are going to serve. So hopefully here you have a working understanding of what we mean by a nerve plexus versus a spinal nerve, and then ganglia. We'll talk ganglia here more in the sympathetic nervous system screencast. Peripheral nerves, the relationship between all of these, the root, the ganglia, and the nerve, and the spinal cord. Probably most helpful to draw a diagram and label it to show me that. And then a dermatome. And then we've identified several spinal nerves, peripheral nerves that you need to know. Okay, thanks for listening. If you have any questions, bring them to class.